Hello, hi, good afternoon.
Hi.
Hi, my name is Caroline. I am here today to do physical assessment on you. How are you doing?
I'm good.
Okay, today I'm here to get a physical assessment on my patient who is newly admitted in the hospital. I'm going to provide privacy. I'm going to wash my hand. I'm going to sanitize my hand. Hi, may I know your name?
My name is Glory Jones.
Hi, Miss Glory John. How are you doing?
I'm good.
Okay. What is your date of birth?
My date of birth is January 15, 1971.
Okay. Can I see your arm breast? Okay. Do you know the reason why you're here today?
Yeah, for physical assessment.
Okay. My patient, I'm able to match my patient's date of birth with her name, matches the document I have, the doctor's order. Hi, Miss Glory John. Do you know the reason why you're here in the hospital?
Yes, for physical assessment.
Okay. Do you know the time?
Yeah, the time is 3:30 p.m.
And what's today's date?
Today is January 24, 2026.
Okay. Do you know the current president of our current president?
Yes, Donald Trump.
Okay. My patient is able to identify the time, the date, the situation, and she's able to identify all that. That means that my patient is alert and oriented times 4. So I'm going to go ahead and get a vital sign on my patient. I'm going to start with blood pressure. Left hand. Okay. My patient blood pressure is 128/67, which is normal. I'm gonna get her temperature, an auxiliary. Okay, her pulse and heart rate, I'm able to get her O2 sat is 100 and her heart rate is 72. And her temperature is 98.4. Okay, I'm gonna sanitize my hand. Then I'm gonna go ahead and jump into the physical assessment. Miss John, do you have any allergy?
No.
Are you allergic to latex?
No.
Okay. I'm gonna go ahead and check my patient's hair. On the head, I'm looking for lice. I'm looking for dandruff. I'm looking for alopecia. I'm looking for any gap of the hair to see if there is any infestation on the hair. My patient's head is intact, clean, no sign of infestation. So I'm gonna go ahead and take off my glove. I'm gonna sanitize my hand. I'm gonna go ahead and jump into checking my patient pulse. I'm gonna go ahead and check the forehead. Okay, I'm gonna check the back of the ears. I'm looking for any kind of lesion, any kind of infection. On the other side, I'm also gonna do that. I'm gonna check her carotid pulse on one side, and I'm also gonna check on the right side also. They are all pounding very well. So I'm gonna check on lymph nodes to check for any sign of infection. There's no swelling, no sign of infection. So I'm going to go ahead and assess my patient's respiratory. Oh, I'm going to go ahead and check his her eyes, her neurological assessment using the pen light. You mind taking off your glasses? Okay. Please follow the lights using your eyes. Okay. Can I be able to access your nose also? Can you raise your head? So I'm also checking the nose. I'm looking to see if there's any drainage. On the other side, there's no sign of drainage. The mucus is musk, no sign of infection. On the eyes, it's quite reactive, no sign of conjunctivitis. So I'm going to go ahead and check the ears. No sign of drainage. Can you hear my? Okay. I'm going to go on the other side. I'm also check. There's no sign of drainage. I'm also going to check my patient hearing, and my patient is able to hear. So I'm going to go ahead and check my patient physical respiratory now. Okay. I'm also going to go ahead and check the back of my patient. My patient respiratory is the lungs are all clear. There's no sign of there's no sign of antivenous breathing. He's breathing. She's not breathing with axillary muscles. Okay, I'm gonna go ahead and check his cardiac. Okay, I'm gonna do 1 full minute of apical pulse. Is that okay if I touch? I take your base up to check. Okay. I'm gonna count 1 full minute. Okay. So I'm gonna check my patient's abdominal area using the bell of the stethoscope. I'm gonna first check, inspect before doing auscultate. I'm gonna first divide the stomach at the foreside. You mind laying on the side for me? So I'm gonna check to make sure there is no abdominal extension. So I'm gonna go ahead and check, starting from the right side. Towards the lower abdomen on the right side. Then I'll go back to the left abdomen. Okay. The abdomen is present. There's no sign of it's active. The bowel sounds are all active and present in 4 quadrants. So after doing that, I'm gonna go ahead and check my patient pulse. Bilateral. The radial pulse is present. I'm gonna check her brachial pulse. They are all present. So I'm going to go ahead and check the femoral pulse. They are all present. I'm going to go ahead and check the femoral pulse. Bilateral. Okay. I'm also going to go ahead and ask my patient to, I'm going to go ahead and ask my patient to open her mouth to check her mouth to see if she have any kind of escape teeth or any kind of dehydration on her lips. You might open your mouth for me? Okay. Okay. Then can you stick out your tongue? Okay, the tongues are musk, the lips are musk, no sign of dehydration. Can I see your teeth? No sign of teeth decay. The teeth are all intact. So I'm gonna go down and check my patient peripheral pulse. And then I'm gonna check for edema. No sign of edema. The edemas there are no edema on the both legs. So I'm gonna check my patient tibia pulse on both. Okay, I'm gonna check for tibia pulse and dorsal pulse. They are all present. So after checking all that, I'm gonna check my patient's the upper strength. Can you put sideways, forward? Can you push using your strength? Okay, my patient upper strength are normal. I'm going to check my patient upper or lower strength too, pushing using my two hands on her bare legs. Okay, my patient have lower extremity strength. So I'm going to check for after checking that, I'm going to go ahead and check my patient peripheral pulse. My patient peripheral pulse will turn 3 seconds, less than 3 seconds. So that completes my physical assessments. I'm going to go ahead and end the video. Thank you so much for watching.